Welcome to The Explainer. Today, we're diving into a massive failure inside our healthcare system that's costing companies hundreds of millions in lost productivity. And we're going to explore how you can actually redesign it.
So, let me start with a question for you. What's the single biggest problem that's hitting your bottom line, but probably isn't showing up on any of your spreadsheets? We're talking about an issue that quietly eats away at productivity, drives up your healthcare spend, and really impacts the well-being of your employees. For a company that has, let's say, just 10,000 employees, the annual loss in productivity can be as much as $340 million. Yeah, that's the hidden cost we're talking about today. Now, that huge number, it doesn't come from a dozen different problems. It all comes down to one single fundamental design flaw in the way our healthcare system is built. In this explainer, we're going to break down what that failure is, and more importantly, show you how a totally new approach can turn this massive liability into a really powerful opportunity. So what is this core problem? Well, it's a simple and honestly a pretty shocking fact. Our healthcare system was not designed for women. It just wasn't. And as an employer, you're the one paying the price for that design failure every single day. I mean, the inefficiency is just wild when you look at the data. Women are far more likely to get misdiagnosed, they wait years longer for the right diagnosis, and they spend on average a full week more per year in poor health. For you as an employer, this isn't some abstract issue. It translates directly into higher healthcare bills and more lost workdays, costs that you end up absorbing. And here's the real kicker. The root cause of all this isn't about blaming doctors or nurses. It's a bug in the system itself. For huge, life-threatening conditions like heart disease, the diagnostic models, they're based on men. The result? A woman is 50% more likely to be misdiagnosed after a heart attack. The system is failing at the most basic level. This 4-to-1 ratio, this really shows you the scale of the problem. Just think about what that means inside your own company. For every one employee you know is dealing with a health condition, there are probably 4 others who are suffering in silence. Their productivity is dropping, their future medical costs are ticking up like a time bomb, all because the system just isn't built to see what's wrong. Okay, so let's put some real numbers on this. Let's quantify the price of all this inefficiency and see exactly how it hits your bottom line. This is where the invisible problem becomes very, very visible. Let's just take one condition. Endometriosis. It affects 1 in 10 women, which is already a huge number. But the financial ripple effect is so much bigger, creating this massive drain on resources that most companies aren't even tracking. Look at how this adds up for just one employee. You're looking at $15,000 in lost productivity, another $12,000 in direct medical bills every single year. But here's the killer, the delay. The typical 5-year wait to get a diagnosis adds another $20,000 to that bill. This inefficiency isn't just frustrating for the employee, it is incredibly expensive for you. And this timeline shows you exactly why those costs explode. The average journey to get an endometriosis diagnosis takes 7 years and 5 different providers. Just imagine the lost workdays, the constant stress, the medical bills piling up. This is the broken, frustrating user experience your employees are trying to navigate all on their own. And it's the same story for other conditions, like PCOS. A mind-boggling 70% of cases go completely undiagnosed. And this isn't just a misdiagnosis today, it's a massive future cost because it can lead to really expensive complications like diabetes or serious mental health conditions down the line. And again, you see that same broken journey. 2 years, 3 providers just to get an answer. So when you zoom out from specific conditions to the whole picture, the impact is just staggering. 70% of women are losing up to 5 days of productivity every single month. For a business, this isn't some small problem affecting a handful of people. This is a massive, predictable drag on the output of your entire workforce. Okay, so we've laid it all out. The problem is systemic, it's urgent, and it's unbelievably expensive. So, what if you could actually fix it? Let's talk about the solution. A brand new model for care, one that's designed from the very beginning for women. This is Ori. Now, it's really important to get this. This is not just another wellness app or a little perk. It is a fundamental redesign of how people access and navigate their own care. Think of it like a smart, personalized guide for your employees' health, a system that finally replaces all that confusion and frustration with a clear path forward. And the genius of Ori's approach is that it completely flips that broken model on its head. It starts by centering the needs of women, not to exclude men, of course, but to correct for the simple fact that the old system was built without women in mind. And here's the thing. When you solve for your most complex and underserved users first, you end up building a stronger, smarter, more efficient system that works better for everyone. So how does Ori actually do all this? How does it deliver on this new model of care and turn all that confusion into real clarity for your employees? Let's get into the nuts and bolts. Ori works through 4 key functions, and each one is designed to fix a specific breakdown in the old system. First, it unlocks benefits. It pulls everything you already offer, all your health benefits, into one simple, clear place. No more hunting around. Second, it connects symptoms. Using clinical tools, an employee can say what they're feeling, and Ori helps pinpoint potential underlying conditions, directly attacking that 7-year diagnostic delay we talked about. Third, it explores solutions, creating personalized plans for managing conditions like PCOS, so employees get a clear roadmap. And fourth, it screens proactively, prompting people to check for those common but often missed issues, which directly closes that 4-to-1 diagnostic gap. So for your employee, the difference is just night and day. Before ORI, they're basically lost in a maze of separate apps and confusing benefit portals, trying to figure it all out alone. With ORI, they have one single trusted guide that gives them personalized, proactive support. You're turning a deeply frustrating experience into an empowering one. And now we get to the part that every business leader wants to see, the financial return. Because this isn't just about doing the right thing for your people, it's about making a really smart financial decision. It's a way for you to make money, save money, and do good all at the same time. The pricing is designed to be super simple and transparent. You can go with a flat fee of just $25 per eligible employee for the whole year, which guarantees access for absolutely everyone. Or you can choose an engagement model that's based only on your active users. It's predictable and it's built to scale with you. And this chart says it all. The business case couldn't be clearer. You see that tiny investment? Just $25 per employee. Then you see the return. If you just recapture a conservative 15% of that lost productivity, you save a minimum of $960 per employee. That's a nearly 40x return on your investment. And honestly, that's just scratching the surface. But the value goes so much deeper than just that one number. This is about a total return on investment. You're going to reduce your direct healthcare costs by catching things early. You'll recapture huge amounts of lost productivity. You'll build an employer brand that actually attracts and keeps top talent. You'll get incredible anonymous data to improve your benefit strategy. And you'll make life way easier for your HR and benefits teams. It is a win on every single level. So this leaves us with one final thought. The healthcare system's design is broken. But as the employer, as the one who's actually footing the bill, you hold the power to redesign it for your people. This isn't just about buying another tool. This is a strategic choice to stop paying for failure. The system wasn't built for half your workforce. The only real question is, are you ready to be the one who finally changes it?